Good afternoon, everyone. Welcome to another session of Facebook Live Cancer Care at American Oncology Institute. And the topic of our discussion today is surgical treatment of esophageal cancer. And today we have with us Dr. Dhanabir Thangjam. Dr. Dhanabir Thangjam is a consultant surgical oncology at American Oncology Institute Imphal unit. And he is an alumni of Don Bosco High School, Manipur. He completed his postgraduate in Department of Surgery from Yashoda Hospital, Andhra Pradesh. And he also did 2 years surgical oncology training from one of the most renowned cancer hospital in India, that is Tata Medical Center in Kolkata. His past work affiliations include being a junior resident at Shrija Hospital, Manipur, and he was also with Jainim's Hospital at Department of Surgery. And he has presented many papers in state and national level conferences and also published articles in many index journals. And he is also a life member of national professional bodies including ASI, Association Surgeons of India, Association of Minimal Access Surgeons of India, AMASI, Indian Association of Surgical Oncology, IASO, Association Breast Surgeon of India, ABSI, and he is also a founder life member of Manipur Oncology Society, Imphal. And he has also won awards in national conferences including SGPGI Breast Course, which was held at Lucknow in 2016, and Midterm Conference IASO, which was held in Rajasthan in 2019. Good afternoon, Dr. Dhanabir Thangjam. It's a pleasure to have you here with us today. And without further ado, let me start by asking, Dr. Dhanabir Thangjam, what exactly is esophageal cancer?
Thank you very much for having me in this Facebook Live. Esophagus cancer or esophageal cancer. Before coming to the cancer part, I just want to briefly say what is esophagus to all the viewers. Esophagus is a human organ, is a body part, which connects the throat to the stomach to pass the food what we eat. And the cancer occurs in the esophagus is due to many risk factors which causes the cell to grow out of control and forms a tumor that is a cancer. This is how esophagus cancer started. And there are 2 types mainly, the squamous cell carcinoma or an adenocarcinoma of esophagus. These are the 2 main types we usually come across in our practice.
Okay, all right, sir. So next, I would like to, ask you, how common is this type of cancer in the country and in the northeastern region in particular? Is it more common in men or women? Okay. Does it depend on the geographical location?
Yes. Globally, according to the Global 2022, the esophageal cancer is the 10th most common cancer in the world. And every year, the world faces around new cases of around 6 lakhs per year. And in India, especially I will focus to the Northeast region. In the Northeast, among the males, this is the most common cancer or in the males, and in the females, it is the 3rd most common cancer in the female in the Northeast region because of many risk factors and what the food habit we are having in the Northeast people.
Yes, sir. So coming to the risk factors, so could you please elaborate on, what are the significant risk factors that contribute to esophageal cancer?
I just want to point out few of the common risk factor. Risk factor is, what is risk factor actually to the viewers? Risk factor means those condition or those factors which aggravate or makes the cancer to grow more. It doesn't mean that it is the cause, but it is the factor which increase the risk of developing cancer. For esophageal cancer, the risk factor which we as a oncologist want to highlight is the uses of tobacco in any form, the use of alcohol, and these are the 2 most common risk factor for developing cancer of esophagus. And also, not the least, these obesities, then some reflux disease, and using of spicy food or beverage. These are the common risk factor which we can say to the people that we should avoid this risk factor.
Okay. Now that we also know about the risk factors of esophageal cancer, let's come to the diagnosis of the disease. So, especially in our region, whenever people have any, initial early signs and symptoms, they tend to, avoid it, or they tend to try to deal with it at home and avoid going to the hospital or avoid, seeing a doctor. So, Dr. Dhanabir Thangjam, could you please tell us when is the right time to visit the doctor and what are the required diagnostic tests, to be done to diagnose this type of cancer?
Yes, maybe this is a very important part for us to explain to the viewers. First is, patients should know what are the common symptoms that which we feel this is and it could be a cause of esophageal cancer. The most common symptoms or problem the patient faces is dysphagia. Dysphagia means unable to eat or swallow properly. So this is the most common risk symptom. Then other is weight loss, then maybe vomiting of blood, then change in the voice or chest pain. So these are the symptoms that patient usually face. If any of these symptoms occurs, the patient or those people should come to the hospital, especially a cancer hospital or some higher center, to investigate, to find out whether the cancer is there or not. So that is the part of diagnosis. So how to diagnose is, for the esophageal cancer, the most important and most useful diagnostic method is upper GI endoscopy. Upper GI endoscopy is a simple procedure, not a big procedure actually, which we use to introduce an endoscope which has a camera on the tip, and it visualizes the entire esophageal tube and see whether there is any abnormal growth or abnormal tissue or ulceration. This is called endoscopy. Endoscopy is the most important diagnostic tool. And the endoscopy, they usually find if some tumors or cells are there, they will take a biopsy, and the biopsy will be confirmed by the pathologist and give the diagnosis of esophageal cancer.
Okay, sir. Now, coming to the most important part of this discussion, which is the surgical treatment of esophageal cancer. How is this esophageal cancer treated? How is the staging done? And what are the treatment options? And what are the facilities available in American Oncology Institute, Imphal unit?
Okay, so first I will take the first question, that is, what are the staging? For every cancer, we have an international body which group the staging, that is AJC, and according to that, we stage the disease. For the esophageal cancer also, we have a staging system. We stage the cancer according to TNM staging. There is stage 1, stage 2, stage 3, stage 4. Actually, these are like when the cancer is in early part or just confined or just inside the esophagus, this will be in the stage 1. If it is spots spreading from the esophagus to the nearby structure, the stage will progress from stage 1 to stage 3. Then finally, when it's spread out from the esophagus and reach to the other various part of the body, then this becomes stage 4. So it's a bit complex actually, but in a such kind of conversation, I cannot directly go add to the elaborated staging system. So how we stage the disease is, after the diagnosis, we take the patient for further investigation to stage. The staging modalities we use, these are CT scan, CT of the neck, of the thorax and abdomen, or we can use a better modality that is called PET CT scan. And once the staging is done, according to the stage, we opted the treatment procedure. So treatment is a multimodality actually, but for esophageal cancer, in the early stage, we have a different treatment protocol. For advanced stage, we have different treatment protocol. And the next question, I think you have asked me about
surgical treatment. How do you, plan for surgeries in esophageal cancer patients? and how is the surgery being done, and also like what is the care given to the patient post surgery? What are the follow-up requirements?
So, as a surgeon, I'm very happy to give this brief on the treatment part, especially on surgical management. So, esophageal cancer surgery has different approach, and actually, esophageal cancer, the surgery name is called esophagectomy, which we remove the esophagus and we reconstruct, means we repair again. So it is a technically difficult surgery because the esophagus lies in the chest, which nearby vital organs like heart and lungs are surrounding. So we have different approach: an open surgery or a minimal invasive surgery, that is a laparoscopy or an thoracoscopy, or even we have this recent the trend coming up of robotic surgery. And how to prepare? For me, I take this question very important, and because this, as I told, esophageal cancer surgery is a technically difficult surgery. We have to investigate, we have to evaluate the patient before surgery very thoroughly, especially the cardiovascular part, that is heart, how the heart is functioning, how the lungs is functioning, and very importantly, nutrition, how the patient is the nutritionally good or bad, because most of them are having dysphagia, means not able to eat or swallow. So the nutrition part is, most of the time they are very poorly nourished. So we have to build up the nourishment, we have to build up the heart, we have to build up the lungs function, and we prepare for surgery. And surgery, most of the time, we also give some form of treatment before surgery, like radiation or chemotherapy. That is called neoadjuvant chemo radiation. This is when the disease is a little bit advanced. Okay, so when this is a little bit advanced, we give the treatment with radiation and chemotherapy to downsize or to bring the cancer in a smaller size, so that we operate. So this is called a neoadjuvant chemo radiation. After completing the neoadjuvant chemo radiation, we give some time, we give some interval, make the patient improve their nutrition and the body to develop their physiological outcomes, like about 4 to 6 7 weeks, 5 to 7 weeks after we operate the patient. And after the surgery, even in some patient, we don't just let the patient go. We have to discuss their pathology report, and if required, we will give chemotherapy again after the surgery also. This is called adjuvant chemotherapy.
Okay, good.
And the question you have asked me, how
soon, sir, how soon should, as you have mentioned, sometimes chemotherapy and CTRT is required before the surgery. So how soon should the patient decide on the treatment? How soon should they start the treatment?
Yes.
After being diagnosed with esophageal cancer?
Once the cancer is diagnosed, as soon as possible, the surgery or treatment should be planned. But there is a big but, because as I said, we have to evaluate the patient. We have to check up the patient, how is the patient body nutrition and everything. Once everything is all right, then we should start the treatment immediately. So to be in a lighter version, say once you diagnose, start the treatment in 1 or 2 weeks, not wait for a longer time, because the stage may increase if you wait for longer time. And surgery, as I told, this surgery has lots of technical difficulties. It also accompanies with complication. So we as a surgeon should have the capability to operate the patient, have the capability to convert the complication or correct the complication risks, everything.
Okay. So, sir, would you, like to share with us some recent cases that has been successfully treated under your care at American Oncology Institute, Imphal?
Yes, maybe a case, if I remember, 3-4 months back. She's an elderly lady, around 60 years. I will not disclose her name and identity. She was partially treated elsewhere, and she could not complete the initial treatment, and she was referred to us. So we restaged the patient. Then we diagnosed the patient, we restaged the patient, and we confirmed that she needs surgery. So we counsel the patient in our tumor board. We have a tumor board every weekly. We discuss the case in our tumor board, and the patient was advised for surgery. So she underwent surgery after the nutritional build-up, then cardiovascular functions, care and all. She was operated in our hospital under my care. We did a laparoscopic surgery, not an open surgery. And luckily she recovered very well in the post-operative period also. She don't have any hiccups, and she was discharged from the hospital around 5 days, and we make her to started eating and drinking from the 7 or 8 day, and she comes back on follow-up after 1 week from her hometown, and when we see, she recovered very well and she was doing fine. And after the recovery, she was again referred back to our medical oncologist for further treatment like chemotherapy. So she completed her full course of adjuvant chemotherapy, and in her initial follow-up, first follow-up, she's doing quite well, and she's improved her body, where she's doing well, and her lifestyle also becomes very comfortable.
Okay, it's great to know that the patients like from Manipur, they don't really have to travel out of the state to receive treatment for esophageal cancer. In fact, even patients from our neighboring states can also come to Manipur to get the treatment done. And one of our goals of this Facebook Live session is to update our viewers, to update everyone watching this session about the treatment facilities that are available here in the state itself. And sir, as we come to the conclusion of this discussion, what message would you like to convey to the public, to aware them about the prevention or reduce the risk factors and help them receive the treatment, the correct treatment at the right time?
So the message for all the viewers is, first, know the risk factors. That is what I have told. I'll just revise again. That is tobacco in any form, alcohol, venous checking of alcohol, then reflux disease of the esophagus, obesities. These are all the risk factors we should avoid. And one more thing, that don't be fear of endoscopy. Endoscopy is a foremost important investigation process that will diagnose esophagus cancer. So don't be afraid of endoscopy, be afraid of esophageal cancer in ST. And how to prevent, how to just reduce the risk factor, the prevention will come accordingly. And early diagnosis, early detection is the most important part of any cancer treatment, as well as in esophageal cancer also. So once you feel this symptom that I have already highlighted, dysphagia, weight loss, and chest pain, change of voice, please visit, consult a doctor, and get the investigation done as soon as possible and start the treatment at earliest. This is the key goal of the complete cancer care of the esophagus.
Okay. With that message, we have come to the end of our live session, and I hope that this session has been, useful and informative for everyone watching it. And let's hope that everyone takes the right decision, for their treatment, to receive the correct treatment at the right time. And once again, thank you, Dr. Dhanabir Thangjam, for your time and valuable insights. And also, I would like to thank the viewers watching this live session. And if you have any query, you can reach out to us through Messenger, or you can post in the comment section. Thank you.
Thank you, everyone.